I am just pumped and excited to talk about East Asian medicine and acupuncture for postpartum. And I'm coming off of a high right now of going and doing a home visit, which is what I do at my clinic. Is after my mamas go through their fertility and they go through their pregnancy, I don't just drop them off and say good luck to you. I go to their house and I see them at home and I see them and a baby and I support them. And I just cannot tell you why this portion and this chapter is so important to continue getting care and not being forgotten about. And I do think this is lacking in our medical system today. And this is where East Asian medicine can thrive and survive and support the mamas and the babies after delivery. So if you are a mama out there who's pregnant and are curious about what's going to happen after you deliver, or if you know anyone who is pregnant right now and is wondering how to recover after pregnancy and delivery, or maybe you are someone who's in the medical field and you're an OB or you're someone who's a midwife, you might not know all we could do for your patient as well. So stay tuned. This one's for you. All right, ladies and gentlemen and family members, when you have just had a baby, it changes everything. You have so many feelings and it depends upon your birth. So there will be very different recovery journeys for someone who's had a natural birth that went smoothly, a natural birth that maybe took a very long time that was painful or difficult, or a medicated birth that maybe didn't go the way that they wanted it to, or even a traumatic experience that ended up with a C-section, or maybe they just chose into doing a C-section just right off the bat. And then there's the question of lactation and breastfeeding. And do we do it? Why we do it, the difficulties or challenges that come with that, and what our options are. So I'm going to go into all of that, if we can, into this podcast. So first and foremost, no matter what your experience, I just want to let every mama know, and daddy too, or whoever is there supporting and seeing this journey, that every feeling is allowed. If you are exhausted, you can be exhausted. If you are elated, you can be elated. But you know what? If you feel angry because it didn't go the way you wanted it to, or maybe you're grieving or losing, there's loss involved in the life that you used to have, and now you have this, or maybe there's fear that you don't know what you're doing and that you're going to do something wrong. All of those feelings are allowed, and they are important to experience and to feel them and to talk about them. And we need support. And when we go through pregnancy, we are in this position of vulnerability, I feel, in this country, of looking to others and doctors and everyone else to tell us what we should be doing. And I do believe, and I think there's many books about this, that the mama and the woman has been kind of stripped, deprived of their power and their strength and their knowledge that goes through their pregnancy as well. And yes, we have a team, and yes, we have medical providers, and yes, we have all of these beautiful people that are here to love and support you, hopefully, through this journey. But the person also who knows what you need is you. And if you need to go internally, I highly recommend that you do. First, in pregnancy, I always tell people to just go away, disappear, and be just with the baby. Because if you go and look at any animal in the animal kingdom, they're not out in the middle of everywhere with, this is one of those moments where they do go internal and they tuck away somewhere quietly, and you have a conversation with that little one and saying, like, it's okay to come out and it's time to come out and it's safe and everything is good. And this is a beginning of a beautiful relationship that will happen. And then after the baby is born, the fear put into mamas oftentimes about lactation and about baby's weight loss. And I just want to take some of the fear out of some of this, or jaundice. And a lot of these things can be natural. The baby, when they come out, especially if you've been medicated and you've been on fluids, is going to lose weight. It's going to lose water weight. You're going to lose water weight. Baby's going to lose water weight. So don't worry as much about that. The baby is going to latch, but we do have to take time, and we have to be patient, and we have to have due diligence, and it will not be comfortable at first, but it will be the benefit once you do get past that discomfort. Baby will come out after being fully enriched by your placenta, and hopefully will maybe not need right away everything. And your colostrum that does come out, they don't need much. Their stomachs are super tiny, and the colostrum is super rich. In fact, so much so that they're now using that as medical treatments. It's like liquid gold. And the importance for doing breastfeeding is, I cannot stress enough, because of an understanding that the milk does have antibodies. There are immunoglobulins that are part of your immune system that you will not get from anyone else and anywhere else. And if that little one doesn't get that immune system support, it will not. It's IgA. So that is very important for you to understand, that you want to keep that going. In addition to that, that is the best way if you're sick or anyone around you is sick or baby is sick. The breast milk is the best thing, because you're going to pass those antibodies down to the baby, and it is, again, liquid gold and the best thing, the quickest way to heal the little one. The other thing as well is, once you get past this discomfort, which I know is very uncomfortable, but once you do get past it, there is an oxytocin release. That's that cuddle hormone that does get released, and it is a very beautiful, comforting feeling for you and little one to have. I also want to make sure that in those few days that we don't get too quick to jump on the pump, because of the baby. Your milk is trying to learn how to calibrate. And when baby is suckling, it's going to help calibrate how much milk that baby needs. When you pump, oftentimes we over pump, and this will sometimes be uncomfortable for baby when they try to latch, because now there's too much coming out. They cannot handle that, and it will make it uncomfortable for them. And not only that, but the breast milk that is coming out does, believe it or not, change according to the baby's saliva. So if we are pumping and stashing something later on and then coming back to give that to baby, just understand if there is discomfort or maybe some gassiness or things of that nature, it can also be related to the fact that's not in alignment with exactly what baby needs at that moment in time. And I'm very grateful that we do have donor milk for those that cannot. There are always certain circumstances, but I just want to say those early days, how important it is to just be relaxed, to be patient, and to drink lots of water, and know that if you have been medicated, that those things are going to be somewhat in the milk until you fully get rid of that and cleanse all of that out. So that's also maybe going to be a little challenge for baby right off the bat. So I want people to stress and understand how does the East Asian medicine fit into that, is that when I come to see you, the sooner the better. It's nice to know, hey, you have someone else here. There are points that actually help activate a little bit of blood flow, of course, but then also the milk production. There are points that benefit the breast. There are points that actually will trigger that release of the milk. There's releasing the stress, moving that, what we would call liver qi stagnation, but moving blood and qi, so, and releasing and relaxing so that milk can come. A large portion of the stagnation, because milk is blood, the milk that's coming out, I mean, if you taste it, it tastes like blood-like. It's blood in all sorts of form that we're nourishing this little one with. So we have to keep that blood moving and keeping that blood flowing. And we want to keep that smooth by not being in a fight or flight or stressful, worrisome, trying to make it, force it, control it kind of situation. So this, I know, is very uncomfortable. You're in a hospital. That's not always natural. and you have people coming in, checking on you constantly, which is why I will say I am a big fan of home births. Those are options, and midwives are available for those that can. It's an amazing thing because it is more comfortable. But for those that can't, we have to remember that we have to work through this and try to shut that out as much as you can and go internal with you and your partner and the baby. And recognize that the acupuncture and herbs, there are also foods that are recommended that will help more with production, and herbs that help with production. There are some herbs that will actually do the reverse. People think peppermint is great for relaxing you, but unfortunately it has the reverse effect in this circumstance for milk production and lactation. So having someone there to support you with that. When you are healing, again, now we're talking about emotional support. I'm so grateful that I can go and be another person to be there and check on mama. And the more people that we can have be there and not just let you drop off and say, good luck, figure it out, but having another person there, having lactation consultants at home, having your acupuncturist come to you to see you and talk to you and see where your mindset is and give you that support. And then as well, herbs are so helpful here. These are kind of like food on steroids in a way, right? You're getting condensed nutritive medications in a way that are going to support your blood, and you've quite highly possible have lost blood, and for some even more than others. And so we want to replenish that and nourish that. I will touch on the fact that, people kind of will make fun and laugh at the placenta, that people don't do here as much in our country, or but if you look at any other animal, they eat their placenta, and the reason why is because it's rich in nutrients. And so if you do have that ability to plan that in advance and see if you can set up with somebody who can prepare that for you. Nowadays you don't have to eat it in a stew, which is what they did traditionally in East Asian medicine, but you can do it and have it dried and put into a capsule, and then you can take that. And I found that useful with the herbs as well for replenishing my energy and blood and helping with milk production. And so I highly recommend doing that too. The other thing that comes along if you're not doing necessarily a natural birth, if you are doing a medically induced birth and there were medications, is that we want to see if we can move the lymphatic system. We can clean the body out. We can be doing cupping. We can recommending certain herbs as well as diet to help kind of clean the system out, clean the body out so that you can heal and repair. And that will support baby, especially if you're breastfeeding. And that will also help. So when I come and talk to baby and they're waking up always at 1 to 3 a.m. and they're extremely miserable, uncomfortable, that's our liver time at night between 1 and 3. And perhaps they need a little bit of support with that too. Do I do acupuncture on babies? I can. Oftentimes they don't necessarily need that. They will do fine with what we call acupressure and a little gua sha, which is like or shoni shin, which is a little scraping. I can talk to more about that on pediatrics on another podcast. But looking at the color, if they are jaundice, there's 2 different types of jaundice, and so we can tell you what we recommend with that. Obviously, breastfeeding is the best thing. Again, is the answer for that. You'll find that for most things. And then recommend the digestion. Foods you might be eating that could be interfering, or foods that you can eat that will help baby as well in regards to coming through the milk. And then another attribute of me being there is giving mama points, acupressure points for baby. Once I see baby and I can look at the constitution of baby, I can say, and they're telling me what the struggles are. Oh, they're constipated. Oh, they're not going to the bathroom. Oh, they're having trouble sleeping. Oh, they're very fussy. Oh, there's a skin rash. These are all very common things, jaundice, etc. And there are points that mama and dad can do to release the discomfort of little one. And another benefit of having us there is to look at baby's alignment as well. So as we're coming through the birth canal, whether it's been with an epidural or not, oftentimes baby, especially if it had an epidural and we have an OB or midwife trying to get baby out, this can cause neck issues or misalignments that, believe it or not, can affect baby and child for years to come. This will affect their sleep if their neck is out of alignment. It will affect their digestion if they're out of alignment. So those little awarenesses and pressure points and doing an assessment early on can make huge differences in baby's quality of life and obviously the parent's quality of life. And there are also chiropractors who do little adjustments for newborns and babies at this time. If they're comfortable with that, I highly recommend exploring that. There's also osteopaths that do adjustments for babies, and you're only setting your little one up for success with those sort of adjustments. So when I arrive, I look at mama. We talk about the birth. I can get an idea of where they feel about it, what's going on, if there's any hemorrhoids that have come about, if there's been any damage, if there's been any tears. There are sit baths that are with herbs that they can do to heal. We can do internally and externally. There are points and acupuncture to help them, again, sleep if they're misaligned. If mom is out of alignment, it can sometimes be a very long birth and they can as well get out of alignment. And then we can move into the cesarean delivery. Obviously, we have a scar that needs to be addressed, and there is points that we can do surround the dragon that are safe around the area that can help increase blood flow and healing of the area. We recommend moxibustion. These are great herbs that are used to help increase blood flow and reduce inflammation. There are herbs as well that will help with trauma and specifically located for the lower abdomen that can help move things along with the healing process with that. And then there's the rehabilitation for the stomach muscles, which I highly recommend working with pelvic floor specialists after you have healed, and other PTs, which is great, as well as using the acupuncture to increase that strength. And then there are herbs that help to lift the pelvic floor as well, believe it or not. And I love doing these treatments. I love helping mamas and dads because I do feel that it's all focused on the birth and then they're home and they don't know what to do from here and they feel disconnected. And the more that we can give that attention and focus and love, then the better mama is and dad is and baby will be. There's definitely a relationship between mom's mental health and physical well-being and how baby feels. There is a direct connection to that. And baby, you're happier, healthier, calmer. Baby will be happy, healthier, and calmer. So I hope this helps. I don't even realize how many people didn't know that we do all these things for mamas, but we do. And if you have any questions about this, you can definitely reach out. And if you have any stories that you'd like to share, please reach out. And I'm wishing you a smooth and healthy birth and baby. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.